Good morning, this is Dr. Pilest. This morning I'd like to discuss and also demonstrate sclerotherapy. Sclerotherapy is essentially injection of a sclerosing agent or a liquid into the veins, into the legs, whereby the vein will get shrunk and eventually the body will come in and absorb that vein. It's a non-invasive procedure which is done very comfortably for the patient. There's essentially no pain. Today we use a product called Sclera, which has been approved in the US recently. It's been around in Europe for many, many years. And the procedure is done without any pain. Procedure has to be, however, repeated 1 or 2 more times after the initial time within 4 to 6 weeks intervals. In this way you can rest assured that most of the veins will be absorbed. After the injection, the leg is basically wrapped with a pressure stocking. And the pressure stocking we ask the patient to wear for about 2 weeks. This will improve a number of things. Essentially, it will decrease the flow of the blood back to the veins. It will decrease the possible matting, which is formation of new veins in the area that you're injecting, and also prevents formation of pigmentation in that area. So these are the veins on her legs that we're going to inject. As you can see, there is 2 sets of veins in here. There are the little ones which are actually red. They're called telangiectasias. And there are the bluer ones which are a little larger, called venuloctasias. And both of them would do really well with the sclerotherapy. So we have in here some Sclera with some foam, and essentially this is a very small needle. It's a 30 gauge needle. We're going to go into the vein and inject. And as you can see, the material that's injected will push the blood off these veins, and essentially the vein will be absorbed. So this is how we go into the bluer vein, the one underneath it. And this vein is actually feeding all the other veins. So when we inject into it, you could see that the other veins around it will start disappearing. And so we'll take another one of these blue ones on this side. And we inject, you could see the blood just goes back up. And then once we're done, we'll just massage this so we can spread the sclerosing agent all over the place. So when this venuloctasias when these are injected, they will go away, and as like we said, they will take all these little small telangiectasias away with them. So we don't have to necessarily inject every vein here. These are all interrelated. They're like networking. So when you go into one vein, all the others get injected as well. So we just finished 1 vial or 1 cc syringe of the Sclera.